questions here. Thanks. It's an honor to be here. And it's an honor to tell you a story. This is a story that I think ties nicely with some of the things that we've already heard this morning about the role of innovation, about taking ideas and turning them into products that benefit mankind. And we're going to give you an example of that. But there's also a connection back to some of the other talks that we heard. Mateus's talk on specialty glasses. This is a story about specialty glasses. And I love the pill chuck talk. And I have to tell you that we built a hot glass shop at S&T about 15 years ago. And there's nothing like seeing a kid discover our material, our glass, in this way. Just the flow and the music associated with making glasses. So being part of that and using that aspect of education, I think, is something that's important and vital. Let's see if I'm going to push the right button here. Yeah, so we're going to talk a little bit about glass science and technology, and then I'm going to introduce Steve with a little bit of background on how a company was built around liver cancer and nuclear waste materials, especially the glasses right there. And then Steve will talk about how taking some of these ideas that started on a university campus and turned into really worldwide products. So we know, glass educators, this is the kinetic theory of glass formation, that glass can be made out of any melt if we can quench it fast enough, right? And so from what might we make these melts? Well, this is our toolkit. This is the toolkit of glass scientists, right? The periodic table. And I don't know, a student asked me in class just a couple weeks ago, what can you make glass from? And I started thinking about just, the last 25 years I've been at Missouri, I've made glass out of all those elements, and there's people from Schott, there's people from Corning, there's people from MOSI. They could probably fill in the rest of that periodic table. But this is the first aspect of glass that makes it so infinitely interesting, infinitely valuable. We can make glass out of virtually anything and then allow those elements to do what we want them to do. That's the first aspect. The second aspect, and we've heard about examples of this earlier this morning, is that we can make glass into functional forms that cover 8-meter mirrors to now nanoscale fibers. And so compositional control and being able to create functional forms, processing flexibility of glasses, makes it a material worth celebrating, right, in this National Day of Glass. So let's talk about S&T. Let's tell this story. And this story starts with liver cancer. Late-stage liver cancer. Late-stage liver cancer is one of these horrible diseases that have very limited options for those who suffer from it. Surgery is available only if there is post-surgical functionality of the remaining liver. There are options for transplants now, but again, this is not often possible for someone with a late-stage cancer. There are ablation techniques, but that's limited to small tumors. External beam radiation is limited because of where the liver is located, and with an external beam, you run the risk of damaging tissue on the way to the tumors. And then, of course, chemo has some remarkably bad side effects. An option that's available, and this was an option that wasn't available when this story started, is radio embolization. Here, one can use a high-dose, short-range radioactive source. So beta emitters in particular, and yttrium-90 is a particularly valuable isotope. This is a short range, a couple centimeters at most. Yttrium-90's got a short half-life. And so if there's a way to deliver the radiation internally, this is the embolization process, way to deliver that radiation internally, one has the option now of treating tumors locally. And then the challenge, this is a glass challenge that will resolve. How do you make a glass composition. This is a yttrium-containing glass, but it has to have some other properties. We don't want the glass to dissolve in the body and release the yttrium to places where we don't want it to be. And it has to have a form that works for embolization. And the form are microspheres that can be injected into the body, transferred to the source of the tumor, and then lodge there. And it lodges into the capillary beds that are feeding the tumor. So it was a problem of composition, and it was a problem of functional form, right? And this guy, Professor Delbert Day at Missouri S&T, he's the guy that figured out how to develop these materials, the compositions and the functional forms to treat liver cancer. So he and his students found that the glass forming system, the rare earth oxide, aluminum oxide, silicon oxide system had relatively large glass forming ranges that included, the desired composition, the desired concentrations of yttrium oxide. These were nice systems because when you activate them, there are no other elements in the glass will be activated, so we're not creating long life radioisotopes, for example, and they had outstanding chemical durability. Again, the idea is we want to get the spheres to the tumor, let the radiation happen, and then leave them in the body to not redistribute the ions anywhere else, right? The other thing, though, on the functional form is that these were good glass formers that could be processed in a way to make these microspheres. And the microsphere production is relatively simple. Take glass powders of the right size, pass them through a flame, spherize them, collect them, and you're ready to go. And so this is just an image. The spheres you can see are 20 to 40 microns in diameter, a little smaller than the human hair. Now, Delbert developed this in conjunction with some colleagues at the University of Missouri Medical School. And then he went out to maybe people in this room and said, I've got this idea, I've got this product, can you help me make it? And they said, sure, how much are you gonna make? He said, well, I think I need about a coffee cup full of these spheres. I mean, these are pretty small spheres, right? And people said, that's not a lot of glass, we're not interested. And so I'm skipping ahead. So the idea here is that the spheres get injected in the hepatic artery. We can see the spheres lodge on a tumor. This upper image is the tumor that was treated. One treatment with the microspheres, you can see the tumor shrunk and the functional liver tissue remains after 8 months. This is just one representative study, right? Liver cancer is one of these horrible, horrible diseases. These sorts of treatments have extended lifetimes significantly without the side effects of many other treatments. So it's really a marvelous story. So Delbert said, I want to make this stuff. Noe said, good luck. Well, everybody said good luck. And so he started his own company. And this is a company that he developed, that formed, MOSI Corporation. And so what I want to do, and so this is a company that started from an academic idea to a market need. And so I just want to tell you two other small stories, and I'm going to introduce Steve, who will talk a little bit more about MOSI. So we got these spheres, and what's the next generation? Well, the next generation would be, let's develop a sphere that, remember, the half-life is 64 hours, and so it's not that long. So can we design a glass that can deliver the dose and then maybe dissolve away, right, and be eliminated from the body? And so this then led to a couple other technologies I want to talk about. But again, the idea is not so much just curiosity-based research, but need-based research with this idea down the road. But it required let's say the academic type of research that those of us in academia enjoy so much, with a market need at the end. So 2 examples. The idea was, let's design a glass that has controlled dissolution properties, that can dissolve in a controlled fashion, to see if we can improve on the theraspheres. So I'm going to tell you about a couple specialty glass chemistries that had this initial idea of improving ionospheres that led off into vastly different, different technological products. So phosphate glasses, those of you guys know me, I know that I'm a phosphate glass guy and I really enjoy these things. These are fantastic chemistries, much different from 98% of all the glasses are silicate-based chemistry. So we'll look at element 15 instead of element 14 here. Phosphate glasses are broad glass-forming systems. They have high solubilities for rare earth elements, which is a good thing for this particular liver cancer application. They can be processed at low temperature. They have generally faster dissolution rates. Now we saw, in the shot discussion, right? These phosphate glasses, these are the type of glasses that power the amplifiers that are used at places like the National Ignition Facility. So really cool materials. But there have been applications of phosphate glasses for biomedical applications. This is some work that came out of London, developing these glass fibers. These glass fibers promote the development of muscle cells, muscle tissue. So people have used phosphate glasses for these biomedical applications. And so we did this research on these type of systems. And one of the things that we found was if you start adding a little bit of iron oxide to a phosphate glass, you can start improving the chemical durability. Well, Professor Day and his students and his colleagues, including me when I was at Sandia, found that this just a simple system, the iron oxide P2O5 system, had a really interesting glass forming range, right? And so we found that if we vary the composition of these glass, we can dial in the chemical durability. We can change the dissolution rates by orders of magnitude. It's kind of what we were looking for with regards to the biomedical application. But we also found compositions that were fantastically durable. In fact, these glasses were more, this is a phosphate glass. Everybody knows phosphate, the amplifier guys know, well, one of the things we gotta worry about is the chemical durability of these glasses. We found compositions that were better than the borosilicate glass that are used for nuclear waste encapsulation. So these glasses were so durable, too durable for the biomedical application, so durable that they turned into an alternate means of isolating nuclear waste. And so now this is a not brand new, it's been around for a while, but this is a new way of encapsulating nuclear waste that started with an idea to improve a biomedical glass, which is kind of cool. That you can think about things that are so diametrically opposed as nuclear waste and biomedical glasses, but they all come from the same idea on glasses. Second chemistry, and this is where I'm going to introduce Steve, are the borate glasses. Borate glasses, again, we know that boron oxide, phosphorus oxide, silicon oxide, germanium oxide, these are the principal glass formers. But again, the practical applications for borate glasses have been limited. One of the neat things about the borate glass, if I start with a silicate glass and start substituting in boron, replacing the silica, I can make the glasses, if I'm in the right compositional space, dissolve faster and faster. Again, this was the idea behind developing alternative glasses for the liver cancer. On the glass science side, these glasses are fun. These glasses are interesting. If I change the composition and change the the fraction 4 coordinated boron, dissolution rates decrease, I can dial in the dissolution rate. All right, that's kind of what we were after for the liver cancer glasses. But this is the other cool thing. These glasses, if I put them in physiological environments, they convert to hydroxyapatite. Those of you that know the Larry Hench story on bioactive glass, these are bioactive glasses. And one of the cool things is that these glasses can stimulate the body to essentially repair itself. So this then led to so the idea on these borate glasses is they react fast, right? And so this then started leading to soft tissue applications for these bio glasses. And so here's Professor Day and our next speaker, Steve Young. Steve was Dell's graduate student at the time, developed this material, and Steve will tell you a little bit about how these glasses are of value. I do want to mention two other people at S&T. Roger Brown is a biologist. Roger developed the animal models that Steve worked on to develop these borate bioactive glasses. And then Len Rahaman was a colleague of mine in the ceramics engineering program, Len did a lot of the initial work on how these glasses converted to hydroxyapatite and a lot of processing thing. So I'm going to introduce Steve, but I want to tell you, so I served on Steve's thesis committee when he got his PhD. I had the honor of nominating Steve for the National Academy of Inventors a couple years ago. And for any of the grad students or advisors of grad students out there, Steve got what, 21 patents out of your PhD thesis? Let that be the challenge to all you guys, 21 patents out of a PhD thesis. So I'm going to introduce Steve. He's going to tell us a little bit about the industry side, the company side of this partnership between academia and industry. So Steve, it's all yours. I think it's all yours.
Yeah. All right, well, thank you. So, it was a very nice introduction there, 20 minutes long or so, right? But, I want to back up just a hair and talk a little bit about why I got excited about what I do today. And so I started at S&T as a freshman in fall of 2000, and I literally learned about glass there. And so S&T's been doing biomedical research for since the gas stuff, 40 years. And so I grew up learning about all these possibilities of what glass can do. But until recently, only one of those ideas became a commercial product. And so I've just always been very interested in trying to bring more of these ideas, into the commercial space. Let's see here. All right. So I was asked to kind of address, how is it we go from concept to the commercialization? How is this done? Especially on these scales, these types of materials, because everything's different. Why MoSci? Why? How do you make biomedical glasses a business? These are very difficult questions. Actually, I get asked this a lot at these types of conferences, and so I want to talk a little bit about how these things actually occur. And then we're gonna highlight the wound care at the end about the story about how that all came about, to kind of walk you through a very short story on how that all happened. So MoSci, as Dick mentioned, was a startup in the 1980s. We lived primarily on the SBIR and STTRs for a long time. And I know that was mentioned earlier in some of those things. The wound care that we're going to talk about later was actually funded by the Army during the Iraq and Afghanistan wars. And so, these dollars are put out there to solve real problems. And I hope that this is a great example of how that actually came to fruition. But we've been in healthcare for a long time. But we have a couple thousand customers that we serve. We ship things to 70 plus countries. And so we really are pretty diverse in where we spend our time. Someone asked me this question not that long ago about why is MoSci successful with the model we have? Because if you ask me what we make, it's like how much time you got, right? We make so many different things. So it really comes down to just three things. We have a focus on glass, research and development, new technologies, but primarily our customers. We listen to our customers and we try to give them what they want, right? Everybody in here does the same thing. This is how it works for us on a small scale. Where we're diverse is the industries that we serve. And so we're in healthcare, we have diversity of scale. I mean, we'll make that coffee cup worth of beads all the way up to 20 tons of something if you want. A lot of companies won't do that. We're diverse in the compositions that we play in. We melt every kind of glass that I know of. And so, and then form factor. Form factor is a big deal. You can take a composition of glass, say like 45S5, the bow grafting glass, and you can pack that into an area that will grow essentially no bone if there's no porosity. Or you can make a three-dimensional scaffold and put it in there and form phenomenal bone. So it's not just composition, but form factor is a huge deal with how we make these products really work. And then there's our strategy. We've got our business relationships. We've got relationships with probably almost everybody in this room on the glass manufacturing side, but then we've got our customer base where we've had relationships for 3 or 4 decades, right? And so we want to bring those things along, offer them the newest opportunities, and continue to build those relationships. We do a lot in IP and licensing, and this is what we're going to talk about today. It's some IP transfer, going from literally the bench scale at the university up to manufacturing scale now for the wound care products. And at least in our business, like there's no one product that would sustain us. And so we're constantly trying to find that next thing to diversify our business even further. So we've talked a lot about, a little bit about medical applications of glass, primarily for vaccines or for drug delivery, things like that. This is a simple list, it's not inclusive, of all the things that we personally do with glass. We make them radioactive, antimicrobial, we can make them dissolve very quickly, or we can make them dissolve never, right? I mean, there's just so many things you can do with glass, and when you have those capabilities, the options for developing, intricate medical devices to solve problems that nobody's solved yet, it actually got a pretty deep bench of ideas of where to go. And so there's just a ton of things that really get me excited about using glass and trying to use those in medical devices. So the primary form factors that we make at MoSci, grind up particles if that's what the customer wants. We make fibers, we make porous scaffold materials for, say, bone grafts or something like that. We make a lot of microspheres. Our founding product, the liver cancer treatment, was a microsphere. We make the microspheres that go into every blood chemistry card used throughout the world. They're making like 100 million of those a year now. And so microspheres are a very important form factor, but they have to be made in a certain way. It can't be roadway beads don't work. You've got to know what you're doing when you make these types of materials. So those form factors end up in these types of products. So that blood typing card I was just talking about, the blood chemistry card is up there. The wells are actually quite small, but when you make hundreds of millions of these things, you use a lot of beads. The picture on the right, the blue is actually what a vial for the liver cancer treatment looks like when it goes into the nuclear reactor. So at the very bottom of that little point is some microspheres, and those are what would get injected into the patient. There's a variety of dental products. How many people here have gone to the dentist and had a tooth filled? And when they did that, they stuck a little blue wand in your mouth to cure out how many? Okay, you've all got MoSci glass in your mouth, okay? So you see how this goes, right? We do bone grafts, we do silver releasing glasses for catheters, but none of these things are massive, in terms of like vials for COVID. We don't make 5 billion of anything, right? But they're still very important. So now I'm going to talk a little bit about the wound care stuff. And so this is kind of our commercialization story that we wanted to talk about. It's very different from glass. And if you just look at it, like, who cares, right? This is something that a doctor would deal with. But it's not. Everything that physicians have in front of them was designed by one of us, a material scientist. And so when you look at these problems, there's like 7 million people in the US walking around with these wounds that don't heal. And if you have an amputation, your life expectancy is about 6 months. This is a huge health problem. And so if you've got one of these wounds, it's not huge, it's not bleeding, you can live with that for a long time, in fact. And some people live with it for years until something else has to happen. And it's not as simple as, we just need to put a Band-Aid on it, we need to clean it. These patients are very sick. They have many comorbidities, so things that are wrong with them, diabetes, vascular problems, nerve problems. It's not that simple. And so this is a serious problem that's been around since the beginning of time, and it's really only getting worse. So this is going to be the 2-minute crash course on how wounds heal, okay? So bear with me. Healing is a cascade of events. It's not like you put a Band-Aid on something and you're healed. So as soon as you're injured, say you get a paper cut, very simple. You get a paper cut, you feel that, it hurts, you bleed a little, then the bleeding stops. A couple days later you get a little inflammation at the site, a few days later it goes away, and then eventually you don't even know you had a paper cut anymore, right? But if I take one of those steps out, it stops. You can't travel from the beginning to the end by skipping something in the middle. And so if you're a healthy person, these things happen naturally, no problem. Well, imagine if you got that paper cut and you didn't bleed, the cut would just stay there. And that's what happens with these diabetics, okay? And so bleeding is like a very key step. People are like, oh, bleeding is bad. Bleeding cleans the wound, and it excites a lot of cellular activity to bring in cells that you need to actually start the repair process. This inflammation step, a lot of people think that inflammation is bad, and so they'll buy these anti-inflammatory creams and stuff, but you don't really want to do that. You need the inflammation. You're just prolonging the healing process actually by doing that. But what do you think happens if you're in this chronic inflammatory state? Again, you don't move on. And so the top two things there, I mean, if we go back and look at this picture of that diabetic foot ulcer, it doesn't look terribly inflamed, and it doesn't look like it's bleeding. So how does it move forward? It doesn't, right? So as a materials person, I like to start with understanding what's the first step. Like if I can't get past the bleeding and the fibrin clot, like you're stuck, right? So we wanted to see, what does that look like? So, as a materials person, we like to magnify things. Here's an SEM picture of a blood clot. Don't know if you've ever seen one of those before, but it looks a lot like something that we're all very familiar with, fiberglass, right? So now we know our form factor. We just have to find a composition that's gonna work in the time frame that we need and be biocompatible, which is what we did. And so we developed this new product. It looks kind of like a little pad, right? But it's made of these nano and low micron diameter fibers. Fibers dissolve at a rate of about 3 to 7 days, which is similar to what a blood clot would dissolve and go away. And it acts as a temporary scaffold to allow your body to start to heal. It's very simple, but it's actually very complex at the same time. And so we actually started another company, it's called ETS Wound Care here. And so now we've had the university technology transferred to a step where we're doing a lot of development, and now it's at the commercialization step. And so here, this is an example of a diabetic foot ulcer from a clinical trial we just completed last year. The wound's not terribly huge, although I think anybody in the room, if you had a wound like that on your foot, would probably be fairly concerned. And so, they treated the wounds for up to 12 weeks. You can kind of see on the left there, the area reduction. We healed about 80% of the total wound area from all the wounds. And if you look at how many wounds were totally closed versus what will be SOC as standard of care, it was roughly 2.5 times as many wounds closed as what you would get if you just went to a wound clinic, right? So we think this is good. But like I said, the wound is relatively small, and I like to make sure that things work. So these are bigger. On the right, or the pressure ulcer, this is an ulcer that was actually kind of located above a gentleman's back, kind of right here. It's roughly the size of a Nerf football, pretty big. It's about 1.5 inches deep, pretty significant. And this guy was unfortunately a paraplegic. He had no ability to move himself. This happened at a nursing home, okay, from poor care. Happens all the time. Within 5 months, we were able to heal this guy. And he has a much better quality of life. Even though it's not great, it's vastly better, and he didn't pass, okay? The other wound, this was an obese woman who was in her 40s, so not an old person at all, but was diabetic, had a trainload of other problems. And so at day 0, what you're looking at there is actually a nasty yeast infection that was growing in there. The smell was apparently very terrible. I fortunately did not have to endure that. But within 4 months, once you get the fungus under control and you get the wound to move on past this chronic inflammation stage that was in, because of the fungus, the wound could continue to closure, and it did. And so it's not a miracle, right? It's just putting the pieces back in place that are missing. And so you can start using this product from the initial bleeding all the way to the end. And so it helps in a bunch of different ways, but always basically putting that next paver in front of you so the wound can make that step forward to closure. And with that, thank you very much for your time.